Joining us on the line is Representative Dan Crenshaw, representative for Texas's 2nd Congressional District, appointed to the Homeland Security Committee and Budget Committee. Dan has a brand new book out called Fortitude, American Resilience in the Era of Outrage. It's a must-read. It really is excellent. Dan, thanks for joining the show. Hope you're doing okay, sir.
Hey, I'm doing well. Thanks for having me, Ben.
So why don't we begin, obviously, with the situation around the country with regard to COVID-19. So obviously, we are seeing the numbers roll in. They're really ugly. What's the situation down in Texas? Because we've heard sort of conflicting media reports about our areas locked down. What policies have actually been implemented in Texas?
Yeah, Texas definitely isn't hit as hard as New York by any stretch, or Louisiana, or many other parts of the country. There's probably a number of reasons for that. We live with social distancing much more so than a typical New Yorker would, or even somebody from LA or San Francisco. So I monitor the number of new cases here in Houston daily, and they're increasing linearly, but not exponentially, and that continues to be good news. Our hospitals are far from being overwhelmed. We're also quite accustomed to dealing with disasters, and our hospitals have often prepared accordingly. We have the Texas Medical Center here in Houston, which is probably the greatest in the world. So we're feeling pretty good. As far as what our lockdown is, it's a safer at home order. So it's not nearly as strict as, say, California or New York, which are more shelter in place orders. And we can go out to we can get takeout. We can go to grocery stores. But for the most part, the federal guidelines are being implemented here.
So when we look forward at the development of the virus, it's very difficult to tell based on the modeling where this thing goes or how we get out of it, because the modeling basically says you're supposed to stay in place for, now they're saying weeks, perhaps months, all the way up to the beginning of June, maybe. And the model from the University of Washington is constantly being revised downward in terms of number of hospitalizations, number of ventilators that are needed. The death tolls are coming in fairly well below where those estimates were even a week ago. They've lowered it now over the weekend to 80,000 by August 1st, which is still a terrible number, but it was 95,000 about 5 days ago. So what are the factors that you are looking for and taking into consideration in terms of how we get back out there, when we reopen the economy, and how that's done?
Yeah, when we look at these curves, people have to understand something. The area under the curve is basically the same. And so the whole point of slowing the spread and taking the actions that we're taking right now was to quite literally slow the spread and to allow our public health system to catch up. So what I want to see from our leaders at the local level and the federal level is a strict adherence to a timeline. Society needs that. We have to balance out what is a true public health crisis from the economical side, because listen, I spoke to doctors here in Houston yesterday. They're not allowed to do a lot of procedures, even though their hospitals are empty. Okay, so people are putting off, potentially life-saving procedures, putting off healthcare. There's going to be consequences here. There are consequences to an economic downturn, whether it's increased suicides or depression rates, whatever, what have you, divorce rates. There are real public health concerns here that are outside the concerns of the pandemic. There has to be balance here. And I think everybody realizes that, but there's this fear to actually set a hard timeline where we say, okay, you know what, we're done with our tactical retreat. Now I'm using military terms here. I would call what we're doing a tactical retreat. Okay, we ran into the enemy. We weren't quite prepared for that enemy. And so we retreated a little bit. We need to get our senses about us. We need to reload our ammo, get our supply lines ready. But then we actually eventually have to go and attack back. And attacking back means living our lives. It means reopening society while we fight the pandemic. And so the metrics we have to be looking at are things like, how many ventilators are we able to produce? And right now it looks about, and this is the minimum, about 5,000 to 7,000 more ventilators a week. Now, there's actually many more being produced that we just can't really measure as easily because they're being produced in the private sector. Oil and gas companies here are reformatting their factories to produce more ventilators. We're producing way more PPE. We're ramping up that production rapidly. And we're looking at ways to build field hospitals. So there's a lot of preparation on the public health side that is occurring. And we should need to tell people, I think, a little bit more clearly that that's the point of the isolation. That's the point of the social distancing. And then that ends, and then we actually come out and fight. We unite, we fight, we get our supply lines in place, and we actually move forward, because we have to balance that out. We have to. I think it's totally unrealistic to think that we continue these lockdowns for months on end. That's not sustainable.
Yeah. So what does it look like when we come out of this? There's been a lot of talking about, people wearing masks, social distancing, mass events still, not taking place. Like the RNC is supposed to take place in August. Obviously, so is the DNC now. The election in November. There's been talk about a second wave that happens in the fall. It basically seems to me that the medical developments will be what the medical developments will be. That the testing will be what it will be, that the ICUs and the ventilators will be what they will be, and that it's going to be very difficult to say to people that we want you to lock down again for months at a time come September, that there's going to have to be some sort of transition to a new normal up to the point when we have a vaccine and we can go back to some sort of real normal. Also, I've yet to hear sort of the factorial decision making from the Trump administration as to when we go back to work. So President Trump is very encouraging that he wants to go back to work, that he doesn't want to see a permanent change between the government and the American citizenry. That's something I'm not seeing from Democrats, who seem to want to use this crisis as an opportunity to radically reshift the balance of power between citizens and the U.S. government. But at the same time, it'd be really nice to know what the inputs are so that we could have some level of predictability. Like, okay, when it gets below this number, we can talk about people who are below the age of 40 going back to work. When it gets below this number, we can talk about how we reopen certain businesses or events of a particular size. We haven't seen any of those sorts of models put out there.
Yeah, and we have to decide. I've seen some suggestions. I think I saw Scott Gottlieb say, listen, after 14 days, if we're seeing a continued decrease in the new numbers of cases or deaths, that's a good indication that we should be reopening that segment of society. Another way to look at it is the R factor below 1 or above 1 as far as the contagion factor, meaning if you're a person who's infected, how many people are you infecting? If it's less than 1, well, then you're on track to reopen the economy. You could, like you said, let's just decide what it's going to be. And we need to give people that predictability. I am still in favor of even without those specific factors, we need to set a timeline and we need to decide that we are just going to fight this. And there are going to be new normals, but we can live in that new normal, whether it's we all wear masks now, we all wear, and we all don't touch each other now, but we can also still get back to work. On a micro level, Americans are pretty good at problem solving. Okay, so we had an office and it was set up this way. Well, we can still work there, but we have to set it up this way now. We should also be investing heavily in the testing regime. That's one thing I didn't mention. Heavily in the testing regime, but also testing for antibodies. So you can imagine a near future, where if we can ramp up the production of millions and millions of these tests to test for antibodies, see who is actually immune, and get them right back into the workforce. Maybe you get that certificate of health, whatever it is. But this is the kind of mobilization that we need to be thinking about and setting a timeline to, because we have to give the economy and our society some predictability.
So, Dan, I also wanted to ask you about some of the media coverage of situations surrounding the coronavirus, not only the coverage of President Trump, but the coverage of the budget negotiations over the single largest spending package in the history of mankind, and then the continued push by Democrats for even more than that. The media coverage of I want to get your take specifically on the firing of this Navy captain who was sending out emails to people who are not in the military chain of command about his opinions with regard to this aircraft carrier. The media have been treating it as though he was a whistleblower when he wasn't actually operating inside the chain of command. It seems to me that while the media has been doing some good work in covering this, they've also been doing a lot of horrible work in deliberately misconstruing information and or just making obvious and stupid mistakes.
Yeah, you listed a bunch of things there, and there's so many examples of awful media coverage from the way Nancy Pelosi blew up the entire negotiation, and the New York Times changed their headlines continuously to cover for her. I have made it my promise I will never let the American people forget what Democrats did that week. It was deplorable. It was disgusting. What ended up being in that bill was barely different from what we had negotiated the last weekend. And now we know, in hindsight, millions of jobs were being lost while she was playing those games, while Democrats went along with playing those games. I just can't believe it. I can't believe that they can never be allowed to get away with that. On the aircraft carrier situation, your analysis is basically right. As far as I understand it, first of all, help was already on the way and being discussed. This could have simply been a conversation between the captain and the admiral, but instead he decided to throw that email out to everybody. And your question is, well, why is the media doing that? Well, and I think you'd agree with this. Our culture these days tends to reward anybody, and this is the left and the right, by the way, tends to reward anybody who goes against the man. right? Who whistle blows and who like, you know what I mean? Who goes outside the norm just to fight against some kind of authority. Like there's some kind of some romantical ideal behind that. I think that's what drives this kind of reaction, even though in reality, the truth is, you know, he really didn't go about this the right way. And it was totally unnecessary the way he did it. You could argue there's some detriment to national security because now it's out in the open. The Chinese know that we have an aircraft carrier that is potentially, going through problems. So yeah, your analysis is basically correct on that.
So moving forward here, Dan, what do you think is going to be the timeline for everybody getting back to work? I know we're all sort of speculating at this point. Again, I keep noting that these models that have been trotted out were too high by fairly large numbers. We hope that continues. It's hard to tell whether, again, that is them underestimating the effect of the lockdowns or whether that is them tremendously or at least significantly overestimating the death rates from the virus because so much of the testing is not available. When do you think that we can actually get back to the new normal as opposed to the actual normal?
It's hard for me to answer that. I'm not in these operations centers looking at all the data. And plus, it really should be different from state to state, from city to city. Again, as I'm looking at the numbers here in Texas, and I just saw that we have less new cases than we had yesterday. So if that trend continues, we should be opening up our society much quicker. If you're in New York City, where people are living on top of each other, even still, there's a different conversation to be had there. They're dealing with different factors that I don't think these models account for as well as they possibly could. These models are guides. They're guides to tell us, possible scenarios. But we also have to just take a step back and plan as if we have more than just the models at hand, right? We know how the virus works, more or less, right? We know that it mostly spreads by touch. We know how to socially distance, but still live our lives in an effective way. We know that masks, how they work, what they do, what they don't do. We're learning a lot more. And again, I really think that we have to set the timeline. If it's the 30 days, if it's at least the federal guidelines, if those are the 30 days, end of April, then let's stick to that at the federal side. And if certain states and municipalities are still having problems, they can react accordingly. You can target. We could target a little bit better. What some people would say, moving from a horizontal approach to a vertical approach. Right now, we've horizontally just covered everybody with social distancing. Well, eventually, we really need to move to this vertical approach where maybe we target certain travel restrictions. All right, maybe we target certain more vulnerable populations, keep them quarantined, let others get back to work. We have to look at testing regimes for certain industries, looking at groups of people that interact with each other a lot. Okay, let's get them tested and then get them back to work. We need to set out this timeline. I keep saying the word timeline, and I'm not in charge, so I'm not going to say what the time is, but I am on the side of sooner than later. I'll say that.
Well, Dan Crenshaw, really appreciate your time. Representative Dan Crenshaw from Texas. Check out his brand new book, Fortitude. It really is worth the read. Dan, appreciate it, and stay safe in there or out there, as the case may be.
Thanks a lot, Ben. Really appreciate it.
I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit the subscribe button so you stay up to date on all of our future content.